Hi, everyone. Welcome to Cure CMD's PCA Guidance Support webinar. Thank you all again for joining us. I'm Avery Roberts. I'm here alongside Kelly Berger. We both work in community outreach and engagement for Cure CMD and our CMD affected individuals ourselves. We're psyched to be able to dive into this kind of complex topic today that is not often covered, but is really at the forefront of the minds of those living with CMD and their families, whether you're caring for someone living with CMD who is on the younger end, or maybe you are either getting ready or are currently living independently. So we're really excited to be diving into this topic today. What you can expect during today's webinar is a focus on how to obtain reliable assistance to complete daily activities of living. You'll have the opportunity to hear how to best prepare, fund, and seek quality personal care attendance for independent living. All right, now our speakers. We have two incredible women joining us today. MARCELLA GENUT, the founder of MG College Consulting, as well as a disability advocate and CMD community member herself. And then JACQUELINE BALDWIN, an investment advisor representative and long-term care planning professional at B&L Financial Architects. We so appreciate you being here with us today. All right, I'm going to pass it over to MARCELLA to take us through how she best handles, as a CMD affected individual herself, the recruitment process, preparing an official care plan, and utilizing some effective communication strategies.
Thanks, Avery. Thank you all for joining. This isn't a complete rundown of everything regarding PCAs. This is just something that I've learned throughout the years, and kind of tips and tricks that I've kind of gained. This can be a really confusing topic, but it doesn't have to be, and I'm excited to share with you all some things I've learned. So I have CMD as well, and I've been living independently since I was about 18 years old. I've had PCAs growing up my entire life, so had quite a range of experience. And today we're going to be talking about 5 different things about PCAs, documentation, communication, the different types of PCAs, recruiting, and onboarding. So first, why do you even need documents? I've found that being organized and having things laid out in different plans have been really, really helpful to keep you on track for hiring, remembering things, and even just your overall plan of care. So I'm just going to go through a bunch of different documents that I have personally utilized for hiring PCAs and things that could be helpful to you in the process as well. So first, I have a variety of recruiting spreadsheets that I use. So first, I have a spreadsheet that kind of has outlined what method I have sent my ad out. So that could be like a contact of an email or a college I reached out to or a Facebook group. So I would write the date that I reached out to them and their contact information so that I can follow up or know when I need to reach out again, or if that contact information is even still valid. I also like to keep a list of every applicant that has expressed interest in the position. So I'll write down how I found them, like how they heard about the job, the status of their application, any notes about them, such as they prefer texting over phone call or different things like that. And then in the hiring process too, on recruitment, you might ask for resumes, references, and a background check for your PCAs to complete to make sure you're all in alignment. And when making an ad, that is a really key point that people often kind of wonder, where do I even start? How do I make even an ad to advertise yourself essentially to finding PCAs. So these are some things that I have learned to really help kind of weed out who would be a good fit for you. I always mention my diagnosis right at the front. You don't have to go into all of your, personal medical information for this ad. Just a quick maybe like diagnosis or whatever you want to say. I typically say I use a power wheelchair and a non-invasive ventilator. So it's up to you what you want to mention. I typically outline the job tasks that PCAs will complete on an average day. Different qualifications that I'm looking for. So if you prefer someone that's male or female, if they can lift a certain amount of pounds, if you need that, if they're a smoker or not, clean driving record, whatever your qualifications you'd like, make sure to have that down as well. I like to be also upfront about pay rate. That kind of helps, save your time and theirs if they're looking for something more pay or, try to get more in alignment earlier on in the process. And then also make sure you have a variety of ways to be contacted for people who are interested in the position. And then this is kind of an example of a quick little ad that I would send out. It could be over email or flyers, but you want to kind of make it eye-catching. Show a little bit of your personality. I write my hobbies down. And that experience is not mandatory. For some people it is. So make sure you kind of have that information if necessary. And people are so bombarded with so much information these days on social media and flyers and ads and all these things. So making yours kind of stand out with your personality and be eye-catching is something that'll really help in the long run. And I've had friends that have used like a website that they've built for themselves to hire PCAs. I've had people use a Google Doc that you can kind of fill out if you're interested. So whatever works best for you to kind of share what you need during the day for your daily living activities works best. And a lot of questions that I guess is, what do I even ask in an interview? How do I even, find people that would be a great fit? My interview process is a bit extensive just because I like to make sure that this person is going to be a good fit and can handle everything I need in the position. So I always ask people just to tell them about themselves, kind of what their interests are, their hobbies, where they're from, just kind of get to know them a little bit. The most important question that I have found is, why do you want this position? That really, really helps weed out people, because if they kind of go along with, I just need experience or I just need a job, that shows to me personally that they're not truly invested and really want this job to care about someone. So, I could hire anyone to be a PCA, but why should I hire you? What makes you a great candidate and a good fit is like what I kind of look for within that question. I also kind of outlined my physical tasks that I'll need help with throughout the day. So repositioning in my wheelchair, all dressing, showering, bathing, those types of things. So asking kind of what their strengths are with that. I typically ask, if they work out or anything, how they've had any experience with those types of tasks. So making sure that you're all clear on the physical aspects of the job. And I also ask about reliability. So this is obviously essential for the job, because if people don't show up, I can't get out of bed on my own, or I'm late to something, or the next person that was supposed to be working before or after them also are late for whatever they had to do because they have to stay because someone is late. I also mentioned that reliability is also covering for other people's shifts and not asking off constantly, being upfront about your schedule. And so I ask if people have shown reliability before and that they understand that you have to be reliable for this position. The last thing that I have found really important in interview is I go through characteristics of people that I'm looking in a PCA. So some examples I've used are being a fast learner, having a positive attitude, and honest and open communication. So I'll kind of go through why each of those characteristics are important to me, and ask if they've had example or had to demonstrate that in a job before, and if they can be and have those characteristics within the job, even during difficult days. So for example, being a fast learner, I'll say, hey, it's really important that my PCAs, learn quickly because it's essential for my routines, because I'm a really busy person and have a job. So it's exhausting for me to constantly repeat myself, and I pretty much have the same routine. So being able to pick up quickly really helps my life a lot. So I get to things faster and also don't have to exude so much energy on repeating myself. So making like kind of your frame of what you're looking for through your lens has been really helpful. Just right off the bat, sharing that is super important so people know the expectations right away, as opposed to later. And then, like I said, my interviews are quite extensive. So then these are questions just asking more specifics about, if they are a good fit. So making sure that the availability they have aligns with what you need, how many hours they're looking for, asking if they have reliable transportation is super important. I found that to be kind of something that needs to be discussed in interviews. If you need assistance with someone to drive you to places, making sure that that person's comfortable with that. And what kind of car you have, if it's a minivan or something small or bigger. I live in Georgia and Atlanta, and Atlanta traffic is horrendous. So one time I didn't ask a PCA about their driving level comfort, and I come to find out later that she was not comfortable driving in the city. So she had a shift scheduled to take me there for like a doctor's appointment. So kind of getting all those tasks out up front and knowing people's comfort level is really important. I also ask like what other commitments people have, if they're a mom, if they have kids, maybe a pet they take care of, or they volunteer somewhere, have other jobs, just to kind of get one, more of a sense of who they are, and two, what their availability is and kind of what they're balancing in addition to this position. And that also just helps you be more empathetic and aware of your PCA. Lastly, I also like to ask what kind of learning method they have. So if they prefer more hands-on, if they prefer notes or seeing things, that way you can kind of tailor your training to best align with how they learn. So I know that was quite extensive, but we shall keep trudging along. So what I have found personally really helpful is to create a handbook of pretty much all of the information about my care. So it's not only helpful to PCAs to have, but also it has been useful in instances with doctors, emergency personnel, and it just has a guide to everything about me and how to care for me, be a fantastic PCA. So what I personally do is have my PCAs regularly updated, and they have actually written it. So I have tasked a few that really know me well to write everything down, and that way they can kind of understand it and read it from their terms. So I know a lot of like the technical or medical side of things, but if they write it, they kind of explain it in ways they understand if they might not necessarily know. For example, I use a nebulizer daily for my breathing treatments. Not everyone knows what a nebulizer is. So my PCAs will write in the handbook, like it's a little black machine that looks like this, or they'll come up with different nicknames of things. So that's just a little bit about the handbook, and I'm kind of gonna talk about what is in the handbook. So I outline pretty much every routine step by step of what to do, so that there's no really confusion, and sometimes that needs to be regularly updated with medication changes or something. Important contact information. So my mom is my emergency contact, and other family members. So having that down is really important. The different addresses of places that your PCAs might need to go. So I have my pharmacy written down, my work address, my home address, any other addresses you think might be important. I also have in there a list of my medications, when I take them, what they do, the dose and everything. And that's been really helpful, even just in doctor's appointments, to have that readily available. I know a lot of us also deal with suppliers, so any DME or respiratory supplies, anything you kind of need, what company that is, and what supplies you get has been really helpful. And especially if you're sick or something, a relative or PCA can kind of take that task over while you're getting well. I also have a list of my doctors and how to contact them, just in case of emergencies, really, and someone needs to reach out to them. I also have like a sick and emergency protocol, outline what hospital I'd like to be taken to, and certain things like that that could be useful just in case of an emergency. During COVID-19, I also had an outline guidance for my PCAs if they had, this system or, they need to have this test done, just so everyone's kind of in alignment. I also have like a list of terminology. So, diagnoses or names of equipment and kind of what they each mean and do, because it can get quite confusing at times. For physical tasks, I personally use a Hoyer lift, but if I do need to be transferred manually, I like a 2-person lift in a specific way. So I have pictures written out in the handbook and a description of like where people need to place their hands, how to lift me, anything that might be helpful for a PCA to know. And then also one fun section that I have that my PCAs have written are just personal preferences about me. That is pretty useful. So I am not a morning person at all. I'm very grouchy, and so I don't like to be talked to in the morning. I don't want people to bother me. So in there is written like, do not disturb Marcella until she's ready to get up and lets you know. I also hate spicy food. So that's like in the personal preferences, really anything like that that might help, just for people to know more about you. So I know that was super extensive again, but it does take some time to make a handbook, but I have found it has been really, really helpful just to make that training process faster, and you're prepared for everything. And so with training, we're on to that. You kind of want to have that streamlined as best as you can so that everyone's getting the same type of training, and it's all the same for all your PCAs. So what I typically like to do is have a group of PCAs train all together, if possible, just to get it all out of the way. I'll go through all my routines, all your equipment you have, medications, physical tasks, and your expectations and contracts. And then next, I believe we're talking about contract. So why do you need a contract? I have found this to be extremely important to just help align myself with PCAs and what kind of guidelines I have. I've had PCAs since I started college at 18, and being a manager at 18 plus going to school is extremely tough, and no one expects you to be an amazing manager right out the bat. So my contract has changed throughout the years. It's a growing document. Things will constantly come up that I've learned from. So don't beat yourself up as well if you're like, oh, this happened, I should have written down the contract. You don't know what you don't know, and that's okay. So being able to regularly update that and talk about it, has been helpful for me. So I'm kind of going to go through some examples I have in my contract that might be helpful to you. So what I do is I use a Google form. That way it's, not wasting paper. I just send out the link and everyone initials by each rule, and then the bottom signs and dates it. This helps streamline the process as well. And I just go over it with them after their training and just to make sure they're all in alignment, have any questions. So again, like I mentioned, positive attitude is important to me. One thing that I've kind of learned, especially if you're living with roommates or family members, having a conversation with everyone in your household on who your PCAs need to go to for questions or concerns, that has been something that I have learned. So making sure everyone in your family is clear on that this is your PCA. Maybe you have a talk with your family and your PCA, has been doing your relative's laundry or something. You don't want that. Just being able to have that regular conversation and writing about that in the contract helps solidify that, yes, this is a rule, and you can refer back to it if you have an instance. I also like to write that you give like as much notice as possible if you were to resign, because the process is quite extensive on hiring PCAs. And then, just treating everything with respect, your coworkers, your things, just how you kind of want interactions to go in your own household, putting things back where they belong. I personally will not be my PCA's friends on social media, just to kind of have that personal boundary, and be a little bit professional. I don't see why people should be, ranting about this job online or talking about it, and I don't want my personal medical information out there. So I just found that to be helpful. I know something that also is a topic for us CMDers is paying for their meals. So I say people are more than welcome to use my fridge and utensils and things, but you are responsible for your meals. If I have extra food, that's just kind of an added bonus. I know another hot topic is phone usage, and if people, are on their phones too much for your PCAs, making that clear. So I have also a rule about, your phone needs to be put down when you ride to work and things like that. So making all those expectations as clear as possible, as well as like keeping a list of things I run out of, like supplies or medications, because I can't physically see them or, do things with them. So I don't know if I'm running low on food or whatever it is. So making sure that regular checking that is important. And I also have another guideline that says before they leave their shift, that they make sure there's nothing else they can do. And I found that to be also extremely helpful, to make sure that there is an expectation when you come in, you have a list of things to do. So I know that was also a lot of information. And again, you can constantly be adding more as things come up, and, your preferences on what you want and expect. Just having regular conversations about it too has been helpful. And so with that comes communication. Um, communication is essential because it is such a closely working relationship with your PCAs. It's pretty one-on-one and intimate, as we mostly know. So what I found to be helpful is using direct and detailed instructions. So I mentioned before that, hey, I'm just a blunt person sometimes, and I just say, this is what I need, and I'm not being rude or anything. I'm just trying to be direct and to the point, because I don't necessarily have a lot of energy to always, add on all these extra parts of what I need done, basically. I have also found just being honest and open really helps. Like I had one PCA come in and take her shoes off, and in Georgia, it's super hot. And so I was like, hey, if you don't mind, do you mind putting your shoes back on? Because you're trying to smell to me. So just being able to be honest and laugh about things like that. And just kind of had an open communication is important. So there's no kind of hard feelings or things bottled up. And for instance, also if you notice like a PCA has been running late a lot, instead of being like, hey, you need to not be late all the time, I kind of frame things from my point of view. So I'll go up to my PCA and I'll say, hey, I've noticed you've been late a bunch. Is there anything I need to be aware of or can do to help you be on time? And when you frame things like that, people have been more upfront and upcoming about personal things they're struggling with. They might not always feel that they can tell you in that moment. So giving them that space to address any concerns with you from like a non-judgmental point of view has really helped me a lot to kind of address problems and concerns, and usually resolves things pretty quickly, I would say. And just see your PCAs as humans, expressing empathy. I always say, like, please let me know if you're having a bad day. We always have them, and I'd rather know and be upfront than you just kind of being in a bad mood all day and I'm not knowing. I'm just kind of wondering what is going on. Is it something I did, So just being there for PCAs, and obviously at times you have to take care of yourself, your mental health. But just know that they are supported by you and you do care about them. It's important. And just letting your preferences be known. So I sometimes really like my alone time and I don't want to chat all the time. So I'll just say, hey, I'm really tired today, or I'm, not wanting to talk in the morning. So just letting you know, hey, this is how I am. Can you please respect that? And just regularly check in with feelings and things that could affect the job. If there's a death in the family or any personal things going on, it's just always helpful to know if your PCA is going through something like that, to be a little more patient and empathetic with them. I also try to regularly give praise just because for us, it's our routine, it's our life. We don't really think about it. It's just like something we have to do and wake up and do. So PCAs, like if they do something a little extra, like remember my favorite snack or something and get it for me, or sometimes like I have a dog and they'll put like a little sweater on him to cheer me up, just little things like that. I will say thank you, really appreciate. And even when they're doing just a good job of being on top of the routine, just think, hey, thanks, like I really appreciate it. It has really goes a long way, even though we might not think of it in the moment. And again, just immediately address concerns. You don't want things to fester and all blow up into all these multiple issues that you have all of a sudden. So I usually like to address things right away if there's a problem and just kind of address it. I know it can be really scary, but again, it's a lot better than someone quitting because so many things have kind of piled up on top of each other. And that way you can probably keep a PCA for a bit longer if you address concerns. Now kind of what kind of PCAs can you hire? So there's two different types that most people hire, and this process can get a little bit confusing. But to make this as simple as possible, you can either pay an agency or you can be an individual, which is called self-consumer directed, and different words to use that type of language. But when you pay an agency for PCAs, they are essentially responsible for all your PCAs. So they hire them, they find them, they set the pay rate. You would contact the agency if you didn't want that PCA again. They would do all the paperwork and training and telling them, hey, these are the tasks you can and cannot do. So it gives a lot of control to the agency, but some people like that because, hey, like recruiting and everything can be really time consuming and stressful, and people would rather not. So it's really just up to you and your preferences. I personally do individual consumer directed. So I have a certain set of budget that I give people a different pay rate. I have to do all the recruiting, hiring, training and letting go. So all the responsibility is on me if I don't have coverage. I outline the tasks that they need to do and go over training, and basically I'm the one responsible. So kind of talk with your relatives and family members on what kind of supports you need and where you would best align with the PCA and what type. And this has been quite an issue lately for a lot of people looking for PCAs is how do I even find PCAs? Where do I even go? A lot of people have really struggled lately with this. So there's a variety of methods, and I recommend not sticking to just one. A lot of people use different forms of media, so they might not see everything on Facebook, but they would within an Indeed ad or something. So making sure you're putting your ad out there as much as possible so it gets the most exposure with people who use a variety of media will be your best bet in terms of recruitment. So there's a lot of different Facebook groups. There's like a babysitters group, at least where I live, and like neighborhood and next door app. So just being on the lookout for different Facebook groups that are in your community. And then a lot of people also just post a general, social media post that people can share to get the word out. And some other websites you can use are care.com or Center City. I personally have had luck with Center City. Caracol, I know some people have and haven't, so it's just worth looking into a little bit. And a lot of people send their ad out to different religious organizations. It has a huge community of people that is already kind of in that community. So sending your ad out might be helpful to you. You can hang up flyers in like coffee shops or grocery stores. What I have personally found to be really effective is word of mouth. So I offer a bonus to my PCAs if I hire someone that they recommended or that they heard about the ad from. And that has been my best way of getting really good PCAs through them and them spreading the word out to different people. And offering that bonus has been a great incentive as well. And then a lot of people hire PCAs that are in college because they're looking for experience and hours. So, sending your ad out to different student organizations there or colleges, direct contacts of deeds, that has also been really effective. And then you can also pay to have your ad on Indeed or Craigslist or other platforms that show different ads out. So that's a lot of different ways. And again, having that recruiting spreadsheet helps to keep all of that organized. And then lastly, we're at onboarding. So the final step of having PCAs, just to make the transition as smooth as possible now that you've hired them and trained them. So now what I do is I'll typically have a day where they just shadow a PCA. And this also can be used if someone's kind of unsure about the job still. So I'll offer them, hey, just come in for this time and kind of see if this would be something you'd be interested or not. They just sit there and kind of take it in, take notes, and think about it. I'll typically have like a trial day. So I'll have a PCA that has worked for me for a bit, stay for a new person's shift, just in case of anything they need assistance with, because training can get really overwhelming and it kind of, they forget all the information the next day. So having someone there just to show hands-on a little bit more how things are done have been really helpful. I have also offered like numbers of contact information to my new PCAs, to my previous PCAs, so that way they can ask any questions or if they have any concerns to address, or I'm busy and they can't reach me for whatever reason. A lot of PCAs really don't mind and love to help out that way. And just kind of knowing, okay, I'm onboarding these PCAs, they don't know what they're doing, kind of planning ahead of time of like being patient. Things always take a lot longer for me when I have new PCAs, just because I'm not used to the routine. So knowing that ahead of time, I'll like tell my boss, or I'll allot more time to get up in the morning, whatever it may be, and I'll kind of show where things are in my house. And just kind of having that at the forefront of your brain and being patient for a certain time until they understand their roles and expectations. So lastly, part of their onboarding is going over all expectations and the contract, making sure there's no questions or concerns. Another thing I like to address is how I communicate through email or vice versa, texting, how quickly I need people to respond, and that's been helpful as well. And so lastly, just a few remaining tips and tricks that I've learned thanks to amazing technology, and also today's time and contacting other fellow people with muscular dystrophy. I have learned that being involved in your community has really been successful for my independence. I live in a neighborhood and we have like little driveway parties where every Friday night we gather a different driveway and just kind of come together and have like a potluck. So just knowing all your neighbors has been very helpful. I have one that is a retired nurse, so she's like, hey, I can bring over food if you need to, or anything you need helping out. I recently had like the power go out, and one neighbor of mine had a generator for me to use. So just being involved in your community kind of gives me a peace of mind of like, okay, I'll be all right. People really care about me here. And if a PCA for whatever reason cannot make it, no one else can cover, I know that I'm going to be okay because I have people in the community that care about me. So that's just something to think about. I also really like to use scheduling apps. So one that I use is called Sling, and you can assign shifts to people. They input their unavailability or request time off. They can also swap shifts in there. So I'll put in the notes if they need to dress up for whatever reason, or if there's any changes to the schedule that day. They can also do that to message each other within there. So a text message doesn't get lost between them. And I have found that to be really successful. There's all kinds of different apps out there to work with scheduling and messaging. So kind of figuring out what works best for you. And then I have some PCAs as well that are like horrendous cooks or some that are really good at cleaning. You kind of learn that as you go. And so figuring out what PCAs are good at what and scheduling your routine around that. So I'll schedule certain PCAs to help me meal prep or do laundry or different things like that. If I'm busy, I'll give a list of tasks to be done ahead of time that they need to do during their shift that I know they can handle on their own. And giving individual tasks like maybe your laundry if you're comfortable with that, or running errands while you're doing different things just to make the most use out of your time and theirs. So that's all of my tips and tricks. I hope this was very helpful to you. You can reach me at my website or my email, and I just really appreciate you for joining. Thanks all.
Thank you so much, Marcella. All right, next we are going to hear from Jackie on the somewhat intimidating and intricate process of financial planning for PCAs. Take it away, Jackie.
Thank you so much. Oh, there we are. I'm here. Marcella, thank you so much. I learned so much from you, and I appreciate all of your tips and tricks and all of that. I'm so grateful. Thank you. What an honor. And I'm grateful. Thank you for inviting me to join in today and to share some of the financial aspects of trying to help pay for some of the services and things that you might be needing. So my name is Jacqueline Baldwin, and I am a financial advisor. I'm located in Connecticut. So my firm is B&L Financial Architects. And you might say, well, financial architects, that sounds interesting instead of financial advisors. And that's because we design, build, and maintain solid financial homes for our clients. And part of that is also involved with helping you to maintain as much independence as possible, and allowing you to have funds that are available to help pay for some of the services that you need and would like to have. So with that said, there are a lot of different programs available, and so today we have a very limited time, and also many of these programs are very specific to your state. So I'm going to keep this generic in nature so that you'll know that you can go and reach out to those within your state to really find what is available for you and what the qualifications are and so forth. It's really important to understand each state's eligibility requirements, how do they work together as far as taxation, and what is available that isn't going to disqualify you from your public resources that you're receiving. So with that said, what I'd like to do is to start. Marcella, you did such a great job talking about PCAs and so forth. And so what I'd like to do is just to say that, and I think you might have already covered that, but eligibility is 18 to 64-year-olds. And you do need to be needing assistance with 2 or more activities of daily living. and be able to qualify for Medicaid. Now, as far as paying for that, each state kind of has its own programs for this. So you're going to want to, again, reach out to your Department of Social Services to find out what's available within your state. So I think I'm not going to go over too much on that, because really these other areas I think are going to be areas that are going to help you coordinate paying for some of the care that you might need. And these are all developed they're designed to supplement the public programs, not supplant, meaning take over for those. So what we're trying to do is to coordinate and give you added resources to pay for some of these from the services and things that you need. So let's start with the ABLE accounts. And so those are the ABLE, A-B-L-E, are actually stand for Achieving a Better Life Experience. And this was established through an act of Congress in 2014. And so what it did was it allowed for individuals to set up an account where they could actually have money deposited in here. And this is currently it's for individuals who have developed their disability prior to the age, to their birthday, turning age 26. I will say, however, that there was an amendment made to this in 2022. And it's actually going to be allowing for up to age 46 starting in 2026. So that's a great improvement. There are some limitations as to how much you can put into these accounts. I'm just going to kind of cover that a little bit here. So these accounts, it's one account per person. So you cannot have multiple accounts, it's one. And currently for 2024, the total contributions that can go into this account are $18,000. Now, if you're working, however, and you do not participate in your employer's retirement plan, you can actually, on top of that 18,000, you can actually contribute up to another 14,580, or your full your maximum annual compensation for that year, whichever is lower. So that allows you to actually maximize and then protect some of those dollars as well. Now, when you put the money into these programs, now they're almost every state, I believe, has its own ABLE account, but you're able to contribute to any ABLE account as long as that state accepts out of non-resident monies. And I believe most of them do at this point. So you can research that, and many of them are managed by, say, an investment institution such as Fidelity, for example. So you can actually invest these dollars. So that's something you can research through your state and see what might make the most sense for you. Now, the benefit to these, in addition to, so you can put money into these accounts, and then that is not counted as a resource available for under like Medicaid. So it's kind of sheltering those dollars. There's also every ABLE account has a different maximum amount that they can have within there. So some are 100,000, some are 500,000. So again, you would want to look to see which one makes the most sense for you. Now, these monies, when you put them in, they're not tax deductible contributions. However, they do go what's called they grow tax deferred. What that means to you is that all the growth that occurs on the monies that you put into these accounts, you're not taxed on each year. It just keeps growing for you. So that's leveraging your dollars because you don't have to pay tax on that. When you take it out, you can take it out as long as it's for a qualified expense. You can take it out tax-free, which is wonderful. So that means, and it's not considered income for you because you're using it to pay for qualified expenses. Now, what is a qualified expense? That's a pretty broad term. So these accounts are actually governed by the IRS. And so you would want to, there is a listing of things. The the thing is, you won't know completely whether everything was acceptable until you file your tax return, unfortunately. So if there's ever any question, I would really recommend using dollars from other resources so that you don't have a problem where, oh gosh, that wasn't a qualified expense, and now we have all kinds of other consequences that you weren't considering. So, but qualified distributions could be things to help offset rent, food, your housing expenses, things like that. However, you do need to use it within that month or a 30-day period. So for instance, you wouldn't want to take out 3 months worth of funds and then be using that. You want to take it out and use it as you go. Otherwise, it will be considered an asset and it could disqualify you. Upon the death of the owner of this, the beneficiary, some states do require what's called a payback, meaning that they are going to require that any funds that are in there are used to pay back any Medicaid benefits received. And then if there's monies left over beyond what the benefits that were received through Medicaid, then those can go to a remainder beneficiary. Some states do not require that. So again, it's really important to check with your state to see what the requirements are and what the provisions are. So I think that's kind of the basics of the ABLE account. So now I'd like to move into special needs trusts. And there are a few different kinds of special needs trusts, and it's really going to be depending on whose money it is that's going in to the trust as to what kind of trust you use, and whether you want to have an individually managed trust or you want to use a pooled trust. So this is going to be a lot of information. And again, I highly, highly suggest that you would work with an estate planning attorney in your state that is aware of all the services available, the requirements, eligibility, as well as your specific situation. And you want to work with an estate planning attorney that actually specializes in special needs planning. So that's really important. But let's just talk briefly on the fact that there are basically first party special needs trusts and third party special needs trusts. So think about a first party special needs trust is your money. So it's money that is yours or would be coming to you through, say, a settlement or something like that. Those are dollars that can go into the first party trust. And those first party trusts need to be funded prior to turning age 65. And then no further contributions can go into those. Again, these can be either an individual trust or a pooled trust. And we're going to get into the pros and cons of those in a moment. A third party trust is other people's money. So whether you receive an inheritance, whether you have money where grantors want to give you money, such as, grandparents, siblings, parents, and so forth want to give you money, then that would go into a third party trust. And there is no age limit on those. So those can continue to receive contributions at any time. Again, being individual or pooled. The first party trusts, by and large, do have what's called a Medicaid lien placed on them, meaning that if you're receiving Medicaid benefits, then there is that state that you're receiving the benefits from, or any states, maybe you've lived in a couple of different ones, has the ability to put a lien on your assets. And so upon your death, there could be a payback to the state in which you received the benefits on a first party trust. Anything that's remaining in the trust after the amounts are paid back to the states for Medicaid can then go to a beneficiary. A third party special needs trust, if there are any remaining assets, and this is one where you would either want it drafted by an attorney specifically, or you might want to use a pooled trust. And again, I keep referencing that, but I'm going to get to that in a minute. But those generally have a remainder beneficiary that's named by the grantor. Whoever's putting the money in or in establishing that third-party trust is usually the one who will then name who should get any remaining assets. And so therefore, by and large, those are not subject to that payback by the states. Now, I keep referencing the fact that these trusts can either be individual or pooled. Individual means that you yourself, in a first party trust, you're kind of the one setting it up and managing it. You could designate someone to a conservator or guardian or somebody to manage that for you. But by and large, if you're setting this up, you are the one managing that. If you wanted to do a pooled account, then that is generally put into, excuse me, I got caught looking at a question. Basically, if you're going into a pool, there's what's called a master agreement, and those are generally run by nonprofit organizations. And that's what all they do is they run these special needs trusts. So the assets are all pooled together. They're accounted separately for each person, but you don't need to worry about trying to hire an attorney to separately design a plan document for you and so forth. So that's great. So the master agreement is already approved. The nonprofit has already gotten that approved. And so therefore you're just the forms are being filled out for the master agreement itself. And then you'd also don't need to worry about trying to make sure that it's staying in compliance and having to refile all of the time. The pooled, excuse me, the nonprofit organization that's managing it will take care of that. Let me see. I think that was kind of covering what I wanted to cover. As far as distributions from these, there are qualified distributions that can come out to help pay for, supplement. So in other words, if you are at home and you have the Medicaid is paying for some of these resources, but there are other things that you need that are not being covered. So maybe you need more hours that are allotted for your PCA. You could actually use either the ABLE account or these special needs trust funds to help pay and supplement some of those things. If you end up needing more care and have skilled nursing, a lot of times Medicare and Medicaid will only pay for certain amounts of medical expenses and care. And so therefore it would be nice to know that you could have some extra care and things like that, and these funds can be used to pay for that. Again, keeping you as independent as possible, and living the best life that you desire for yourselves. So, and what was I going to say? I think I had something else I was going to say. Maybe not. I wanted to keep this very generic in nature, again, because it's very specific to your unique situation. Such as funds that are available, whether they're all your funds or somebody else's funds, what resources are you currently receiving, and then how do we build up this whole web to provide you with all the care that you need and desire and want without jeopardizing those public programs. So I think that's about what I had to say for you for today. I do highly encourage you, however, when you're talking about finances, don't try to do this alone. Really do hire and work with professionals in your state that can really help you. Because if you try to do this alone simply by Googling and reading things on the internet, you run the risk of disqualifying yourself without ever really knowing that that was going to happen, and we don't want to have any unintended consequences. So it's very, very important to work with somebody that is well versed in this area.
All right, thanks so much, Jackie. That was very informative. We will kick it off now to our Q&A portion. So we'll go ahead and start with our first question here, and I'm going to direct this one to Marcella. So how do you navigate friendships with PCA? Do you have, if there's friends that want to be part of your care team, or you become friendly with the PCA, how does that dynamic work?
Yeah, this is a great question and something that has taken me a really long time to kind of balance and figure out. I'm just as you're learning and growing as a person, really. So I have had a hire a few friends before, and I was absolutely petrified because I just heard all the horror stories about hiring your friends. So I just had an honest conversation with them and said, "Hey, I'm really scared. I don't want to lose you as a friend. I really value our friendship." And my friend that was also PCA, she was like, "You can fire me at any point. Like, please don't feel like you can't come talk to me." And it actually did turn out to be a really good relationship as a friend. But first she was a friend and then PCA, and then vice versa. I've had PCAs that turn into friends. It's something that is can't really be forced, and I don't think you can expect all your PCAs to become your friends. Sometimes it naturally progresses, but just still making sure that there's a couple of boundaries in place. There's some certain topics I don't discuss with PCAs, or I'll ask like to leave them to leave my room if I'm having like a private phone call or something. And just kind of not expecting anything from them has really helped me. And I would also get upset like if people left the position and I thought we were friends, but they didn't keep in touch or things like that. So just learning that PCAs are for a season at times, and I've had some PCAs leave and haven't heard from them in a few years and then come back and now we're like great friends. So it really is quite a range, and just kind of even expressing your emotions to them and outlining your expectations has been really helpful for me. But yeah, that's a really good, tricky question.
Right, and I'll actually ask you a question too, kind of follow up to that. I know you mentioned your care team, and obviously this will vary from needs to needs, but what is the sweet spot as far as a number of PCAs for your care team? What do you suggest is like a safe one, taking into account backups and kind of all that?
Yeah, that's another great question. So it's really up to everyone's preference. What I have found that works great for me is that I would rather have a lot of people that didn't work a ton of hours. I've just learned that when people do work like close to 40 hours, if they, decide to have a child or get injured, then I am essentially really out of luck to get any coverage. So having a lot of people not work a ton, but being able to be backup for each other. Plus, I realized I prefer a lot of different personalities than just dealing with like one or two people. And even though I really like them, sometimes they would get on my nerves. So just kind of figuring out, what works best for you. So I typically hire college students, and then I have about two PCAs that are available more like 30 hours or full time about, and can kind of take me to different doctor's appointments and when things come up. So I hire about roughly about 8 to 10 college students. And this is also a bit tricky because they're only there for a short time. So I'm just kind of having that in your brain that it's going to be relatively a quick turnaround, but I try to give incentives on how people can stay. So I give bonuses for the longer they stay and things like that. That's worked really well for me. So I've also hired a few people just for backup, but sometimes that works and sometimes it doesn't because people mean well and they're like, "Oh, I really want to help out," and then they're never available. So just kind of making that as an expectation, like if you are going to say that, please actually be available. So I do typically hire about like one or two people to be as backup, especially for weekends. I found that's the shifts that need the most backup. So
Great. No, that's all great information to know for sure. And we did have another question. I'm gonna pass this to Jackie. So what if someone only has Medicare and doesn't qualify for Medicaid? Are able accounts still worth it? And are there any other help or planning for future PCAs out of pocket that you can recommend?
So actually, I think you can be eligible, I believe, as well, if you can get a doctor's certification. You have to meet there's a requirement in the statute. So you could try that. But also, just because you may not be eligible today, I would again highly recommend that you work with, there are individuals who are specialized just in Medicaid applications, and they can really help you decide, how close are you to becoming eligible for Medicaid, or what needs to happen. I know that I have clients that are older, needing long-term care, and I've worked with Medicaid specialists on that. And even though they didn't qualify at that moment for Medicaid, we really helped design that. So there are ways to if you needed to do a spend down, for example, making homes, those are all qualified expenses. There may be ways to get approved. So I would, again, highly recommend that you work with an estate plan attorney, a Medicaid specialist. And then, yes, I would say that those are going to be, ABLE accounts are great because of the fact that they are easy to use and access the funds for them. It's much easier than a special needs trust, and the cost is minimal, very minimal. It's no different than really having like an IRA account or something like that, where these special needs trusts, the cost can get very exorbitant. So yes, I would highly, highly recommend that you, again, work within your state to find out what the qualifications are, and then absolutely know if you're not eligible today, what is going to happen and transpire for me to be eligible. So that's what I would recommend. So that you have all your options laid out ahead of you, rather than waiting and find out that you actually could have been doing this a year ago. Find out now so that you can plan ahead.
Okay, great. We did have another question. I'll toss it to you, Jackie. They say if they have insurance through work and Medicaid, is applying for Medicare worth it?
I would say yes, because Medicare is, if you have enough quarters and you've paid in, I would definitely recommend exploring all of that and seeing what can be covered, because you may be able to link together. So for example, if you're on Medicare and you still have an insurance, you may be able to actually get additional services. So you can kind of link those together and look at the benefits and see what you can be receiving in full benefits. It's all coordination of benefits. And I know that sounds daunting, and it is. It's a full-time job, and I don't, that's where you need to have professionals come in. There's also professionals that really specialize in Medicare. So for example, I am a financial advisor. I cannot specialize in every area. So I bring in professionals from all these areas to help my clients, because that way I know my clients, I'm not missing something for them, because these are the people that deal in this every single day, and they know everything that's happening within their state and their governmental programs. So yes, again, I would explore all opportunities, and no, just because you may not qualify today or it doesn't make sense today, all the research you're doing today is actually going to help you in the future as well. So then you're going to know, oh, well, when I hit this milestone or this marker, now what I wasn't eligible for or I couldn't coordinate with my benefits are now going to be available for me. This way, you're always kind of staying ahead of the loop, rather than saying, oh my gosh, I could have been receiving these benefits all this time and I've missed out.
Great, all super helpful advice. But we will wrap up our Q&A here. Avery has some closing remarks. We appreciate your questions.
Okay, before we officially wrap up, we did just want to bring the community's attention to these noteworthy additional resources that are available. So carepathways.com is great for getting access to reviews and advice on potential local options. And then Carify is a new program out of Medicaid that connects individuals to providers. So they're both pretty neat resources that are worth checking out if of interest. And then along with those resources, we did just want to remind you all that Cure CMD recently teamed up with the Caregiver Compass for this all-in-one notebook designed to provide a streamlined approach to scheduling medical appointments, connecting to healthcare professionals, tracking medications and therapies, and more. Basically, just kind of overall capturing all care aspects to stay on top of. If you use the promo code CureCMD15, you have the opportunity to save 15% to celebrate the launch of the CureCMD edition dedicated to our community. Thank you to everyone for joining us today. Thank you to our speakers. We're so grateful for your willingness to share your expertise and insight in these complex areas. We hope you find value in exploring this info, some tips and resources, as well as more specific considerations for someone living with CMD specifically. Make sure to mark your calendars for our next webinar, our Accessible World webinar, which will be taking place May 18th at 1 p.m. Eastern. If you have any questions, please feel free to reach out to us at outreach@curecmd.org. We're more than happy to answer any questions, whether that be related to the webinar or other CureCMD programming, as well as if you have anything come up after this event, we're more than happy to pass any questions to Marcella and Jackie as well. If you found this content valuable, we'd really appreciate it if you'd consider a gift to ensure that we can continue to provide these beneficial and supportive resources to our community. You can scan the QR code on your screen or head to curecmd.org/2024 to show your support for CureCMD. It will for sure go a long way in helping us continue the work of our mission to advance research and empower the lives of those living with CMD. And then just to keep the conversation going, please share with us what you learned today by tagging us at CureCMD and on all social media platforms. And you can also use the hashtag CMD guide. All right, thanks everyone again for joining us and have a great rest of your weekend.